and the young people, especially those...
Recent statistics from the Uganda AIDS Commission indicate that HIV prevalence stands at 5%, with young people accounting for 15,000 cases. Owing to this scenario, the Ministry of Health has partnered with Ugandan network of young people living with HIV/AIDS to promote HIV prevention and adherence to medication among youth who test positive for the disease.
I feel there are some spaces where I have gone to, and when you speak of HIV, it feels an alien thing.
And one of the strategies being looked at is the organization of beauty pageants among young people living with HIV.
We know if we are going to end AIDS as a public health threat in this country, the number one tool we are going to use that is going to contribute majorly is to identify people living with HIV, empower them to live freely without stigma, take their medication well, because we have discovered that people living with HIV, when they take their medication well, they live healthy lives and they do not transmit HIV.
So in this way, we brought up as a beauty, a Y+ beauty pageant, that is a young positives beauty pageant, which is aimed at promoting awareness on HIV, 1, 2, decreasing the stigma within districts of Uganda.
The pageants are also intended to combat discrimination which continues in society towards people living with HIV.
Young people are born into the stigma we created, stigma towards HIV. If the beauty pageant is one way of the young people to shed off the stigma we handed down to them, let it be. And the good news that it has been there for 10 years, we see it is only associated with positive things. The young people who have been empowered through the process of the beauty pageant, which goes across the whole country. They get empowered with information.
We want at the end of 2030 to arrive at a place where we have 0 new HIV infections. So if you're negative, the encouragement is for you to protect your health and stay negative. For those who are HIV positive, my message is on adherence. For you to take your medication very religiously, for you to protect your mental health, so that at the end of the day you're able to achieve your dreams.
However, efforts need to be directed towards eliminating mother-to-child transmission, especially among partners living with HIV.
When we break the statistics, on an annual basis we register 4,700. There is an improvement, but it's not good enough. When we break the statistics clearly show us that approximately 12 babies are born by mothers or by partners that are living with HIV on a weekly basis. That is a very big number.